It's a demonstration of the emergency health issue diagnosis and first aid advice suggestion expert system. First, it asks what type of issue you are dealing with. If you have a good idea what the health issue is, like whether it's a burn, a fracture, or a shock, you can enter it here. Otherwise, if you have no idea, you can go through the first option and let the expert system diagnose the issue based upon the symptoms you have. So I'll go with the first option, and here it gives a list of symptoms. So uh, let's say I have bleeding, then it will ask for a what kind of first aid equipment is available with me. So I'll put I have bandages and antiseptic. So then again it asks whether I have been exposed to these activities like a head injury or a cold exposure. So I'll say no, and then ask the current location. So with those, it will first give the diagnosis. So it's a you may have cut tissue, and the diagnosis is given with an uncertainty score. So here 95%. There's a 95% probability that I have a cut issue, and also why it gives an explanation why this diagnosis was concluded like this. So since bleeding is occurring, there's a high probability to be a cut somewhere in the body, and then afterwards it gives the first aid treatment. So it says keep calm and follow the following procedure: clean the wound and apply antiseptic and bandage uh, it to stop bleeding. So based upon the equipments that I have, it has given this first aid treatment. And also in addition, if it's a location specific, it also gives a location advice. So here, since I said this happened to me in outdoors, it gives this advice: in outdoor locations, ensure the area is safe from further injury sources, and sanitize hands if possible before administering first aid. So yes, that's a basic example. Let's see a demonstration of the uncertainty, different uncertainty scores. So I'll get no idea. Then I'll input that I have confusion, headache, and nausea. And I'll say I had a head injury. So here I have given 3 symptoms and an activity. So altogether 4 observations. And I'll say I have some of these. And you can see here, since I gave like 4 observations, because of that the probability of having concussion is 97%. Now let's try that again, but with less amount of symptoms. I'll say that I have the same set of symptoms, headache and nausea, but I have no idea whether I had a head injury. So then again, a couple of these, and here you can see this time because of the lack of observation data, the probability of diagnosing concussion has reduced to 80%. So this uncertainty score is calculated by incorporating Bayes' theorem inside the rules of the knowledge base. Let's see another example. So let's see alternative diagnosis example. I'll say I have swelling and pain symptoms, and I have a sprained an ice pack with me, no idea at home. So you can see here that for the for those symptoms, two diagnoses have been given. So I have 70% chance of having a fracture and 30% chance of having a bee sting. And here you can see I have enough equipments to actually treat the fracture, first aid equipment to treat the fracture. So here it has given immobilized area using a splint and apply an ice pack to reduce swelling. But here you can see that I am lacking one of the first aid equipments to treat the bee sting issue. Here it has given that you are missing the following equipment to provide first aid for your bee sting issue. This equipment is missing to provide proper first aid treatment for a bee sting issue. Then I will demonstrate alternative treatments. Example, again I'll just directly say I have a burn. So this here, so you can see that alternative treatments have been given. Either you can perform this first treatment, cool the burn under running water for 10 minutes, this one, or you can do this second treatment. So it can also not only give alternative diagnosis but also can provide alternative treatments based upon different set of available first aid equipments. Now let's try to do the same diagnosis and treatment, providing examples, but this time by using backward chaining method. So this time the rule base is changed to a backward chaining rule base, and the previous examples demonstration was actually done by using a forward chaining rule base. So here I will demonstrate how the backward chaining will happen. Again, same as before, this the issue is us. I'll say I have no idea. Then I'll say I have the bleeding symptom. So you can see here, just as soon as I gave the bleeding system due to backward chaining, the diagnosis is provided to me, and again with the explanation why this was diagnosed as this issue. And I will continue to provide the inputs saying I have a bandage and say antiseptic. Then after that it will give the first aid treatment procedure, clean the wound, and I will say then it is asking where currently located. So this is to give the location advice. I'll say I'm outdoors. So here you can see it gives the outdoor advice, and with this there's nothing to give. So I'll say I have no idea about the issue again. Then I'll say I have breathing difficulty and coughing symptoms. So ask like what kind of activities you have been exposed to. I'll say no idea. So it came to this diagnosis that I have choking with this uncertainty, and again gave the explanation for that. Then I'll say I have some of these equipments. As you can see here, it has given alternative treatments for me to treat this choking issue. Either use this maneuver or do this second one, and the execution has finished. So this is a demonstration of alternative treatments by using backward chaining.